So, if you're watching this video, you're probably interested in how to beat anxiety attacks without medication. Welcome, my name is Peter Strong and I specialize in online mindfulness therapy for the treatment of anxiety, for panic attacks, social anxiety disorder, generalized anxiety disorder, agoraphobia, obsessive compulsive disorder, and many other forms of anxiety disorders. Many of my clients have already tried medications prescribed to them by their doctors or psychiatrists and find that they don't seem to really help in the long run. They might provide some temporary relief from symptoms, but they do nothing to really change the underlying psychological process that produces their anxiety or panic attacks. And this is the problem with medications. They're not really designed to change the psychological process that produces anxiety, only the symptoms. So if you're interested in learning how to beat anxiety without the need for medications, you might be interested in learning the methods of mindfulness therapy that I teach online. It's quite easy to get started. All you have to do is send me an email and we can schedule a Skype therapy session at a time that works for you. I see people throughout North America, Europe and the Far East, so it's quite easy to get started. All you need is a good internet connection and Skype. Mindfulness therapy is extremely effective for working with the underlying process that creates anxiety and also depression. This underlying process is primarily one of habitual reactive thinking. It's a process whereby a stream of automatic habitual thoughts gets triggered, and then we become lost in this stream of thinking, which simply feeds back to the underlying anxiety and strengthens it. The whole purpose of mindfulness therapy is to help you become more conscious of these underlying psychological habits so that you can change them. Because the moment you become really conscious of these habits, that consciousness always brings with it an element of choice. And you can begin to change the habit quite directly, simply by making it more conscious. You can also change the habit by working with the structure of the emotion itself, which is really about changing the internal imagery of the emotion. So all emotions are structured around some form of experiential imagery. It's the way we see the anxiety in the mind that determines its strength. So consciousness and mindfulness will help you uncover this internal imagery. And when you uncover that imagery, again, you have choice. And in this case, you can choose to change that imagery. And when you change the imagery, you change the emotion. You are essentially teaching the emotion how to change itself when you change its imagery. Simply email me if you'd like to learn more about how to work with emotional imagery, It's a very fascinating area and very, very effective indeed for most emotional problems such as anxiety and depression. It also works very well for emotional trauma. So I work with PTSD as well. The trauma is produced, of course, by those very painful memories that come back as flashbacks. Well, those memories are essentially images, and those images have certain qualities which can be changed. When you change the imagery of the trauma, you will change the intensity of that emotional trauma as well. So this is an overview of how we can use mindfulness therapy for working with anxiety and other emotional problems associated with anxiety. If you would like to learn how to beat anxiety without using medications, please go to my website, learn more, and then send me an email, and we can schedule a trial Skype session for you so you can see for yourself just how effective the mindfulness approach can be. Thank you.